Hello everyone, and welcome back to the Oral and Maxillofacial Surgery webinar series. My name is Omar, and I am the webinar director at the SCORE committee. It's a pleasure to have you all with us today for the second session of this series. Before we begin, I would like to briefly introduce the International Association of Dental Students, IADS, and it is the largest global organization representing dental students worldwide, connecting students from different countries and creating a platform for academic exchange, professional development, and cultural collaboration. This webinar series is organized under the SCORE Office of IADS. SCORE stands for the Standing Committee on Research and Education, and it focuses on research, education, and international collaboration. Through SCORE initiatives, students have the opportunity to engage with experts, participate in global projects, and gain valuable learning experiences. We hope you will find today's session insightful and beneficial. It's a great pleasure to welcome Dr. Mohamed today, and we sincerely thank him for sharing his expertise with us today. To introduce our speaker and guide us through the session, we would like to hand over to my colleague Adham.
Thank you, Omar. Today's webinar titled A Roadway Way for the Management of Medical Emergencies in the Dental Office, introduced by Dr. Mohamed Hamdy, who is an oral and maxillofacial surgeon. His biography: Dr. Mohamed Hamdy is a lecturer and consultant of oral and maxillofacial surgery at MSA University in Egypt. He earned his master's and PhD from Cairo University in 2016 and 2021, respectively. He is currently the director of Implant Clinic at MSA University, course director at Clinical Masters of Implantology program, member of Faculty Implant Committee, and member of Faculty Evidence-Based Committee. Dr. Mohamed, the floor is all yours now.
Greetings. Hello, everyone. Thank you, Dr. Adam and Dr. Omar, for this kind invitation, for this kind introduction. I'm honored to be here with you today. I hope you find my lecture fruitful. I think this topic is very important for all of us as dentists and GPs, because medical emergencies are very important to identify and to manage. I will share my presentation right now. Okay, let's start. Our lecture outline will be as follows: the importance of preoperative patient assessment, basic classification and identification of the emergency kit. For the part 2, we'll be covering prevention and management of different emergencies in the dental office. Before we start our presentation, we have two main questions that need to be answered. These questions are medical emergencies common in the dental office? What are the chances that every dentist could face an emergency during routine dental treatment? And for these questions, the literature says medical emergencies occur in over 50% of dental practices annually, and 2.1 events are reported per dentist per year. So as a dentist, you will be, believe me, you will be exposed to a medical emergency as long as you are practicing dentistry. The most common medical emergencies faced by dentists were vasovagal syncope, accounting up to 60% of cases. Okay, so there are two main questions that need to be answered during our presentation. First one, what should be done before any dental procedure? And second one, what should be done during any emergency? For the first question, what should be done before any dental procedure? Obviously, it is a preoperative patient assessment and evaluation. Believe me, preoperative patient assessment and evaluation is very, very important. If you give it all of your time, invested your time and your knowledge in preoperative patient assessment, you will be safe and you will save your patient's life. However, if you didn't pay attention to small, tiny details, you will face a big problem. In order to do a preoperative patient assessment perfectly and correctly, you need to have and acquire two main skills, which are collective knowledge you need before starting any dental procedure. You need to collect the information you gained through your dental knowledge, dental education, information from your physiology class, anatomy class, pathology class, surgery, and medicine. You need to collect all of this information. And the most important one, you need to have a systematic thinking. Without systematic thinking, your knowledge are nothing. Believe me. You need to have a systematic thinking. You need to know how to think, how to use all of your information to assess your patients perfectly and accurately, and know what are the risks you are going to face during any dental procedure. Okay, so if you did it correctly, you will save your patient's life. Now, preoperative patient assessment and evaluation, you need to know and ask your patient all and every tiny small detail about his medical background. I'm sorry, his medical history. You need to know if he has any allergies from any antibiotics, any analgesics, any allergies, if he was admitted before for in the hospital, why he was admitted, did he have any blood transfusion. You need to cover every and small detail about the medical history of your patient. If you did it correctly, you are in a safe side. Now, I think most of you are familiar with the ASA classification. ASA classification is a well-known, broad, international classification regarding patients' health. It classifies patients' medical condition into 5 categories: ASA1, normal healthy patients; ASA2, patients with mild systemic disease, like a patient having a controlled hypertension, controlled diabetic; ASA3, patient with severe systemic disease that limits his daily activities but is not incapacitating; and ASA4, patient with incapacitating, life-threatening medical condition; and lastly, ASA5, a morbid patient, which is commonly terminal stage of cancer. He acquires no treatment, yet only palliative treatment. So, regarding the emergency kit, the emergency kit is one of the most important tools that you need to have in your clinic. And regarding the emergency kit, there are 3 main components and 3 main points you need to cover, and you need to be sure that these points are fulfilled. You need to label all of your drugs, and on that label, you need to write the expiry date of each drug. Lastly, you need to have education. What do you mean by education, Dr. Mohammed? Am I needed to be educated about the drugs? I already know it through my study here in the college. No. Education means, as a clinician, you are responsible, and it's your responsibility to teach and educate all of the staff members in your clinic what to be done when we face any emergency. You need to assign everyone with a specific task. If you have 2 assistants and an office boy and a receptionist, you need to assign assistant number 1. You will bring the emergency kit. You need to do a training for all of them about the emergency kit, where we keep it, what are the content and the components of the emergency kit. Assistant number 2, you will call for help. you need to assign specific tasks for everyone in your clinic. If you do it so, besides you are thinking systematically and you have done your preoperative assessment very well, you will save your patient's life and nothing will occur, inshallah. Okay, the content of the emergency kit. What are the most important components in the emergency kit? First one is oxygen. Oxygen is very, very important to have in your clinic, either a full cylinder or a portable small cylinders. Mostly oxygen will be the only sole definite treatment in most of the common medical emergencies you will face in your dental practice. So oxygen is very, very important, but you need to be aware when you are having oxygen in your clinic and when you are using oxygen during any emergency, oxygen is flammable. So you need to keep that in mind when you use oxygen. Second one, epinephrine. Epinephrine is very, very important emergency drug in when we face multiple emergencies like anaphylaxis, etc., as we will cover in our lecture. Epinephrine comes in an easy pack, is a easy pen, EpiPen. EpiPen is auto-injectable epinephrine. It injects open 3 milligram epinephrine in subcutaneous route, not intramuscular route. It delivers epinephrine through subcutaneous route. Second one, you need to have a rapid-acting corticosteroids like dexamethasone or methylprednisolone. You need to have a rapid-acting corticosteroid when we face emergencies like acute asthma, when you face emergencies like anaphylaxis, allergic conditions. Corticosteroids will be very, very beneficial. Another very important component is a bronchodilator. Bronchodilator, the most common bronchodilator inhaler is a Ventolin, containing salbutamol as an active ingredient. It is very important to keep a bronchodilator in hand in our emergency kit when we deal with any asthmatic patients. Most of you will say, okay, Dr. Mohammed, but as we studied during our academic study, that every asthmatic patient, he needs to bring his own bronchodilator with him. Yes, but you need to be ready if the patient didn't bring the bronchodilator with him. A very important thing that most of us do not know is how will we deliver the inhaler. During emergencies, the routine delivery of inhaler won't be enough and won't be correct, and it won't deliver the correct amount of drug through the bronchi. So you need to have, with your emergency kit, you need to have an aerospacer or aero chamber. As you could see, the aerospacer or aero chamber is a vacuum tube sealed around the patient's mouth and patient's nose from one side, and from the other side, the inhaler. By using the aerospacer, you will be sure that all of your drug is delivered to the patient's bronchi. Another important component is antihistaminic. Antihistaminics like phenadramine is very important when we face emergencies like anaphylaxis or any kind of allergic conditions. Anti-hypoglycemic drug. When you are dealing with diabetic patients, the most common and most important and most serious life-threatening emergency is hypoglycemia. Hypoglycemia is a very important medical emergency. You need to have anti-hypoglycemic drug to manage this emergency as fast as possible. Again, anticholinergic drug. Atropine. What do you mean by anticholinergic drug? Anticholinergic drug is the drug used to manage bradycardia. Again, it is a drug that used to manage bradycardia. There is a difference between, I think most of you know, there's a difference between bradycardia and the hypotension. Hypotension affects the blood pressure, but bradycardia affects the heart rate. So when you have a state of bradycardia, not hypotension, you need to have anticholinergic drugs, atropine, to manage this emergency. You need to have a respiratory stimulant, ammonia. This is a very kind drug you need to have in your emergency kit. Usually it is done when you are facing a state of vasovagal syncope. It will be very beneficial. You need to have a sublingual nitrates. When you are dealing with a patient with ischemic heart disease, patient had a medical history of angina pectoris or myocardial infarction, these patients are commonly using sublingual nitrates for vasodilating effect of their myocardium. And I know most of you know that when you are treating any ischemic heart disease patients, you ensure that the patient is having his own sublingual nitrates with him. But again, you need to have it in your emergency kit as a backup plan. Among the most important components of the emergency kit is local hemostatic measure. Local hemostatic measures to manage bleeding could be very, very, very beneficial. Bleeding as an emergency, it could affect the operator dramatically. It could affect the patients dramatically. It could affect the patients, your assistant, and anyone who was coming with your patients. The sight of blood itself is fearful. So you need to have a local hemostatic measure to manage any kind of bleeding during your routine dental practice. The most common local hemostatic measures is a gel foam or gel sponge, collagen sponge, and the capron, which is it prevents the breakdown antifibrinolytic drug. It prevents the breakdown of the patient's blood clot. So it allows the blood clot to stays for a much longer time. So we're ensuring we're having a state of hemostasis for a longer time. Lastly, you need to have a pulse oximeter. The portable pulse oximeter is very, very important to have in your emergency kit. It will give you insights about the patient's heart rate, so you will know if your patient's having bradycardia or not, and it'll give you insights about the saturation of oxygen in the patient's blood. So pulse oximeter is very important. Okay. What should be done during any emergency? This is our second question for our lecture. What should be done when you are facing any emergency? Just imagine a scenario when you are having routine dental work, having restorative or prosthetic procedure for your patients, and suddenly an emergency occurred. For the untrained dental practitioners, most of them, when they are facing an emergency, most of the untrained dentists will panic. So, do we need to panic when you are facing an emergency? No, no, no. When you are facing any kind of emergency, you need to be very, very calm, as fear is contagious. You need to be very, very calm when you are facing any emergency. Most of you will say, Doctor, how would I be calm when I'm facing an emergency? If you didn't be calm during any emergency, believe me, you're having a very big problem. You are not able to give any orders for your assistants. The patient's medical status will deteriorate. You will not know how to think correctly. Your systematic approach for the management of this emergency or any kind of emergency will fail. if you panicked. So please, when you are facing any kind of emergency, any kind, please be calm. Okay. What are the general steps in any emergency? So these are the most common and most important general steps when you manage any kind of emergency, anywhere in our dental office or anywhere. So you need to address the position of the patients, the airway condition, breathing of your patients, circulation, and the definite care when you reach the definite diagnosis of your emergency. For the position, okay, doctor, we are having an emergency. Okay, I could remember from our surgery lecture when the patient has lost his consciousness, the first thing is position. So we need to position the patient in a supine or a prone or in a recovery position. I believe most of you are familiar with these terminologies: supine, prone, and recovery. Most of you will say, okay, we will sit the patient in a supine position. Okay, no, it won't affect your patients. This is wrong. Okay, some will say, okay, doctor, we will elevate the patient's legs. Okay, let me ask you why you are doing to lift your patient's legs. Some would say, okay, I need, when the patient has lost his consciousness, I need to maintain the circulation to the brain, which is correct. So we are lifting the patient's leg like this, so the blood would fall from his legs to his brain. Blood do not fall. The correct position for your patients when he has lost his consciousness is a Trendelenburg position. A Trendelenburg position is a condition or is a position when the head of your patients is slightly lower than the patient's trunk, and you put the patient's legs like this. Why you are putting the patient's legs like this? By putting the patient's legs like this, we are using the benefit of the muscle tone to improve and to accelerate the venous return to the heart. So we are accelerating the venous return and the blood supply to the brain. So the Trendelenburg position and putting your patient's legs like this is the correct position for any emergency. For any emergency. Secondly, the airway. For the airway, you need to make sure that the airway is patent. You need to remove any appliance or any object that could obstruct the pathway of the airway. The first thing you could do is a head tilt chin lift. Head tilt chin lift is a widely known maneuver to open the patient's airway. Second, if you're having patients wearing denture, you had an emergency during your try-in procedure for a bridge or a prosthetic appliance, you need to remove any removable appliance from your patient mouth. You need to have a suction to aspirate all of the saliva from the airway. You need to keep your airway patent. A very important tool that you could have in your emergency kit is the airway appliance. The oropharyngeal airway is one of the most common and most beneficial airway appliances. It is hollowed from the middle, so it allows the patients to breathe. It is positioned just posterior to the patient's tongue, so it displaces the tongue anteriorly, opening the airway, and you could do a suction through this hole. Breathing. So you are finishing patient position and patient airway is patent. You need to see and to hear that your patient is breathing. You need to see the chest movements, and you need to hear and feel the breath of your patients along your ears. This is very, very important. But you need to do this once you are making sure that the airway is patent. If your airway is not patent, the patient will not be able to breathe. So clear the airway, check if your patient is breathing or not. Lastly is the circulation. By circulation, you need to check when the patient has lost his consciousness, you need to check if the patient has pulse or not. The most important landmark that we could use for checking patient's pulse is the carotid pulse. I think most of you are familiar with that common artery and how to detect it. Once you confirm your patient is not having any pulse, you need to do very important 2 steps. You need to do a CPR, cardiopulmonary resuscitation, and a very important step you need to do is you need to achieve an IV line. All of dentists worldwide should learn how to put and how to achieve a patent IV line. Believe me, if you could learn how to do an IV line, this IV line in sometimes is the life-saving procedure for your patients. Okay. All of these steps, the position, airway, breathing, and circulation, should be done and fulfilled in a time not exceeding 25 to 30 seconds. Not exceeding 25 to 30 seconds. And by the collective knowledge of the information you gain from your patient during the preoperative assessment, and by the use of your systematic thinking, you have reached a diagnosis and of your medical emergency. And accordingly, you will do the definitive care of this emergency. So let's cover the most common emergencies that most of us will face in our routine dental practice. First one, local anesthesia toxicity. Local anesthesia toxicity is one of the most common medical emergencies faced during any dental procedure. You're having surgery, you're doing surgery, you're doing a restorative procedure, prosthetic procedure, you give local anesthesia. So the chance you are giving intraarterial, intravascular injection, it is very high, even if you have done a double aspiration procedure, during if you have a nerve block. So a patient will have a toxicity from your local anesthesia. The most common signs and symptoms of local anesthesia toxicity, patients will be very apprehensive, patient will be sweating will be increased, patient will be pale, patient will feel palpitation of his heart rate will be increased. And lastly, the blood pressure will be increased. The patient will have hypertension, followed by hypotension and syncope. So, what will we do when you are facing local anesthesia toxicity? It seems very big medical emergency, but the management is very, very simple. Local anesthesia toxicity needs only oxygen. It needs only oxygen. Oxygen will prevent the drug from reaching the tonic-clonic, the seizure threshold of at the brain. So the sequela of local anesthesia toxicity is seizures. Patients will having seizures. Oxygen prevents this from happening. It elevates the arterial oxygen level and decreases carbon dioxide oxygen level, because carbon dioxide, when it is increased in the cerebral blood flow, it triggers the seizures attack. Vasovagal syncope. Vasovagal syncope is one of the most common medical emergencies in our routine dental procedures. As we said early in our lecture, vasovagal syncope accounts nearly 60% of the medical emergencies faced during dental procedures. Common signs and symptoms of vasovagal syncope: sudden collapse of blood pressure, loss of consciousness, and bradycardia. Okay, when we are going to say our patient is having a vasovagal syncope, not a cardiac arrest or any kind of emergencies, as we will say. Vasovagal syncope, you assume your patient is having a vasovagal syncope when you are taking, when you have took the preoperative assessment and the medical history very accurately. So vasovagal syncope, you can't be your first differential diagnosis when you are having a patient with ischemic heart disease, or when you are having an asthmatic patient, or you are having a patient with adrenal insufficiency. The vasovagal syncope, we commonly assume our patient is having vasovagal syncope when our patient is ASA1, medical-free patients, having insignificant medical history. So when your patient suddenly loses his consciousness, it most commonly is a vasovagal syncope. Okay, but be aware that vasovagal syncope could be accompanied by a state of bradycardia. What is your management of the vasovagal syncope? Very simple. Position, airway, breathing, circulation, deliver your oxygen, and use ammonia spray. Using ammonia spray as a stimulant, it will be enough to reverse the state of the vasovagal attack. You need to monitor your patient vital signs very, very accurately. Because as we said before, the vasovagal syncope, the increased tone of the vagus nerve, it could affect the heart rate of your patient. So patient could have a bradycardia. If patients developed a state of bradycardia, you need to use your atropine, your anticholinergic drug, and you need to transfer your patient to the hospital ASAP. This is very, very important. That's why we said you need to have a pulse oximeter in your emergency kit. Without your pulse oximeter, you won't be able to identify the state of bradycardia affected by your patient. Pregnancy. Okay, pregnancy is syncope. When you are treating a pregnant lady, as we all know, dental procedures are allowed during the second trimester, during the fourth, fifth, and sixth month during pregnancy. That's the safe time for our treatment to be done. So, when you're having a patient, pregnant lady in her sixth pregnant month, and you put your patient in a supine position and you're having your dental procedure. A very important step, very important knowledge you need to have for any pregnant female is the state of supine hypotension syndrome. You need to be familiar with this condition, the supine hypotension syndrome. Supine hypotension syndrome occurs when your pregnant lady is lied in a supine position. The baby in the trine is compressing the inferior vena cava. As we all know, the inferior vena cava is a main venous blood vessel that collects the venous blood from the lower extremities to the heart. So if the inferior vena cava got compressed, you will not have an accurate venous return. If you didn't have enough venous return, your heart, the heart load will be low, the heart rate will be low, so the patient will lose her consciousness. So when you are dealing with any pregnant female, please, please, please never put your patient in a supine position. Yet, if your patient got collapsed, if your pregnant female patients got collapsed, don't put her in a Trendelenburg position or a supine position, yet put her in a position at a 45 degree and put a pillow below her right waist. Why her right side? Right-sided waist. As you could see from the cross section of the anatomy of the pelvic female, the inferior vena cava is present in the right side. So when you are putting a pillow at the right side of your patient, you will be displacing the uterus to the left side. So you are decompressing the inferior vena cava and restoring the normal venous return and the cardiac output. So this is very important. That's why I said before, during management of any patients, you need to have a collective knowledge of all and every information you have studied during your college life. Angina attack. When you are managing a patient with ischemic heart disease, you need to be very alert for signs of angina attack. The most common signs and symptoms for angina attack is the chest pain, substernal chest pain related to the left shoulder and left arm. And by the way, most commonly it will not happen. Most commonly it will not happen. So you need to be aware of all of the sign symptoms that could affect patients having an angina attack. Chest pain relating to left shoulder and left jaw, and even relating to the patient's back, palpitation of patient's heart, hypertension, sweating. These are the most common sign symptoms for the anginal attack and myocardial infarction attack. For the management of the angina attack, you need to gain access very rapidly to the sublingual nitrates. Sublingual nitrates, it promotes vasodilation for the patient's coronary arteries. This is very, very important. Angina attack develops from deprivation from the myocardium, from the blood supply during atherosclerosis or blood clot in patients' coronary arteries. The sublingual nitrates, it promotes vasodilation to the coronary arteries. You starting by giving sublingual nitrates and you wait for 5 minutes. You repeat if there is no development. You repeat the sublingual nitrates. You wait for another 5 minutes. If the patient does not respond and some symptoms get worsen, you give the patient another sublingual nitrates and transport him as soon as possible to the emergency, but you need to do a very, very important step. Which step is this? You need to give your patients a 200 milligrams of aspirin. Why were you giving aspirin? If the patient's sign symptoms does not improve by the 3 sublingual nitrates tablets, most commonly this patient is having a myocardial infarction. So there is a blood clot. So by giving the 200 milligram aspirin orally, ask your patient to chew it, it will decrease the risk of myocardial infarction. Aspirin, as you know, is an antiplatelets, so it will decrease for somehow the incidence and the effect of the myocardial infarction to your patient's myocardium. Adrenal crisis. Adrenal crisis is an emergency that we face when you are dealing with a patient who has adrenal insufficiency. Adrenal insufficiency, most of us, when we are treating patients with adrenal, taking external and supplement of corticosteroids, most of us will panic. Why do we panic? Because we know patients with adrenal insufficiency could develop adrenal crisis and it is a life-threatening medical emergency. But be calm. By systematic thinking and collective collaboration of any knowledge you have gained, you will be able to manage adrenal crisis very professionally. Signs and symptoms of adrenal crisis. Of course, you need to have your patient is having adrenal insufficiency, taking external supplements for corticosteroids. So the most common sign symptoms is hypotension, sweating, loss of consciousness, and a pale skin. For the management of adrenal crisis, the patient does not have corticosteroids to manage any trauma or any stress he is facing. So if he is not having corticosteroids, you will give corticosteroids. The management of adrenal crisis, position airway breathing circulation, you call for help immediately. You give 200 milligrams IV corticosteroids. That's why I said before, you need to acquire this skill of how to put an IV line, a patent IV line. You provide sufficient IV fluids through the IV line you have created, and you monitor vital signs. But a very important step or a very important point during the management of adrenal crisis is how to prevent it, how to prevent the patients from developing adrenal crisis. You need, through your pre-operative assessment, you need to identify patients who are or patients or are having adrenal insufficiency. How will you identify these patients? By the rule of two. Rule of two, if your patient is taking more than 20 milligrams of corticosteroids or its equivalent 2 times daily during the past 2 years, if you achieved 2 points out of these 3 points, so your patient is having adrenal insufficiency and it needs corticosteroid supplementation. This is very important step. That's why we said before, preoperative assessment and evaluation is the core step in managing any patient in our routine dental practice. Thyroid crisis. Thyroid crisis is a medical condition, is a medical emergency. All of us need to pray not to face it, because thyroid crisis have a high, very high mortality rate worldwide. For the thyroid crisis, patients who is having hyperthyroidism, during your preoperative assessment, you made sure that your patient has a hyperthyroid state. Of course, we do not do any dental procedure for uncontrolled thyroid patients, and the management of these patients is long. But to make it short, we do not doing any dental procedure for uncontrolled hyperthyroid patients. Okay, so we are treating a controlled thyroid patient, hyperthyroid patients. The controlled hyperthyroid patient could develop with pain during dental procedure, fear and anxiety. He could develop a thyroid crisis. The sign symptoms for the thyroid crisis, patients becomes very, very apprehensive, Patients having palpitation very loudly, patient having significant hypertension, followed by severe hypotension, and most commonly, patients will having a state of hyperthermia. This is very, very important. And lastly, patients will having sweating, and he will lose his consciousness, and he will having a cardiac arrest. For the management of thyroid crisis, you need to follow position airway breathing circulation as soon as possible, call for help. You need to give 200 milligrams IV corticosteroids. You need to provide sufficient ice packs to reduce the hyperthermia. Thyroid crisis, patients will have cardiac arrest. Patients will have severe hypertension. This hypertension even could cause stroke, could cause rupture of retinal or renal arterioles. It will affect multiple organs. Besides all of these complications, you need to address the state of hyperthermia. For the state of hyperthermia, we literally cover the patients with ice packs to control the hyperthermia. We even give cold IV fluids. We even give or do stomach lavage through stomach nasal ryle with icy or cold fluids to control the state of hyperthermia. So that's why thyroid crisis has a very high mortality rate. And I think most of us pray he will not face a state of hyperthermia, hyperthyroid crisis. Hypoglycemic coma. When you are managing a diabetic patient, as we know, when you are managing or treating any diabetic patients through your preoperative assessment and evaluation, you need to know if your patient's which drug he is taking. Is he taking insulin as a management for his diabetes, or he is taking oral hypoglycemic drugs? Also, you need to make sure before starting any procedure that your patient has consumed his meal and took his morning medication. That's why you will be confident that the patient is not having any problem with his food and his drug. So when you are treating an diabetic patient and suddenly the patient has lost his consciousness, you are having two options. Either the patient is having a hypoglycemic coma or hyperglycemic coma. Most of us will address the hypoglycemic coma solely. Why? Because hyperglycemic coma has a low mortality rate in comparison to the hypoglycemic coma. The glucose is the nutrient component or molecule for our brain. So when you are having a hypoglycemic coma, we are at risk of developing hypoxia to our brain, cerebral hypoxia, and it will affect the cerebral blood flow and the condition of the brain dramatically. Common signs and symptoms of hypoglycemic coma: pale skin, sweating, patients feel slight drowsy, hypotension, and palpitation. If you have reviewed the literature, these signs and symptoms commonly match with the hyperglycemic coma. But when you are treating diabetic patients and the patient has lost his consciousness, you assume the patient is having a hypoglycemic coma, not hyperglycemic coma. Because if your patient is developing a hyperglycemic coma and you have given a glucagon, which improves the sugar blood level, it will not affect the hyperglycemic state he has. Yet, if your patient is having a hypoglycemic coma and you assumed that your patient is having a hyperglycemia, and hyperglycemia, the management for hyperglycemia is insulin. Imagine if you are facing a state of hypoglycemia and you misdiagnosed it and you give insulin. So you didn't save your patient's life at all, unfortunately. The glucagon, it comes with a preloaded syringe for fast delivery intramuscular injection to reverse the state of hypoglycemia. Bronchial asthma attack, acute asthmatic attack. Acute asthmatic attack occurs when you are treating an asthmatic patients. There are lots of things to be done when you are dealing with asthmatic patients, starting with the position of the patient during the routine dental work. You need to position your patient in a comfort position according to him. This is very important. You need to make sure that your patient brings his own bronchodilator inhaler with him, and you're having your own bronchodilator in your emergency kit. The signs and symptoms of bronchial asthma attack is chest tightness, dyspnea, difficulty in breathing, cyanosis, and wheezing. You need to be very alert for these conditions. Again, to make sure When you are facing any medical condition, you will not see the full picture of this emergency. By example, bronchial asthma attack. You will not face all of these sign symptoms. You could only face dyspnea or wheezing. So you need to be very alert when you are dealing with asthmatic patients. The management of the bronchial asthmatic attack is to firstly provide the bronchodilator again through your air chamber. During the bronchial asthmatic attack, do not deliver your bronchodilator inhaler routinely. Please use the air chamber for correct delivery of the full amount of the full dose of the inhaler. You provide oxygen, and if sign symptoms got worsen, you need to call for help immediately, and you need to give subcutaneous epinephrine by the use of the EpiPen in the emergency kit. Why epinephrine? Epinephrine is a very, very powerful bronchodilator, but we keep it for the life-threatening and as a last reserve. And lastly, you could give your patient also 100 milligram corticosteroids to decrease the inflammation affected by the asthma to his bronchi. Anaphylaxis. Anaphylaxis, sign symptoms of anaphylaxis is the generalized body rash, angioedema, hypotension, and dyspnea. Anaphylaxis is a state of allergic condition, hyper state condition, when the patient is exposed to an allergen. To make sure anaphylaxis does not occur by the first exposure, during the first exposure of the allergen. It occurs during the second exposure. During the first exposure, the body develops the immunoglobulins and antibodies for that allergen, and by the second exposure, allergen and antibody, it will collide and it will cause the anaphylaxis. Anaphylaxis is a serious, life-threatening medical emergency. It is a very, very serious, life-threatening medical emergency. So you need to manage it as fast and as soon as possible. You give your patient, first of all, you call for help. Obviously, you start position airway breathing circulation. Your first drug is epinephrine, and epinephrine during anaphylaxis, it is delivered through IM, intramuscular injection, not subcutaneous. Through intramuscular injection, not subcutaneous. You give your patient 100 milligram corticosteroids, 150 milligrams antisemitics drug, Avil, and you give dextrose IV, and you continuously supply oxygen, and you monitor vital signs. The dextrose IV, why you are giving a dextrose during anaphylaxis? Dextrose, it promotes the aerobic metabolism of your muscles. And the aerobic metabolism of your muscle, the end product is oxygen. So oxygen helps dramatically in managing anaphylaxis. You are giving external oxygen, and by giving dextrose, you are delivering oxygen internally. And by doing this, you have covered every step for the management of anaphylaxis. I am so honored to be with you today. I hope my lecture was fruitful for you. I hope we have covered the most common emergencies during dental procedures. Again, last piece of advice and a take-home message: please, please, please pay attention and give all of your time during the pre-operative patient assessment and evaluation. If you have done it correctly, you will save your patient life and your life. And if you didn't pay attention, and if you were reckless, during the preoperative assessment and evaluation, you will lose your patient's life and yours. Thank you all. This is my email and my Instagram link. If you have any questions, I will be happy to answer it. Floor is you, Dr. Adam.
Thank you a lot, Dr. Mohammed. We will have some minutes for receiving the questions and answering them.
Okay.
We have a question. Beyond having an emergency kit, what specific team-based simulation drills do you recommend to ensure that every staff member from the receptionist to the dental assistant knows their exact role during a high-stress event like an anaphylactic reaction or a tonic-clonic seizure?
Okay. This is a very nice question. As I said before, it is your responsibility to educate all of your staff members their specific role during the management of any emergency. You need to educate your staff member where we are having our emergency kit. What are the components of the emergency kit? What is the specific role of each one during any emergency? During anaphylaxis, it could be, as we said, it is a life-threatening emergency. So we need to act rapidly. By the way, when you are facing any emergency and you have done all of your drills, it could be custom made according to anyone. You could do a drill for any kind of emergency, anaphylaxis, bleeding, angina, any kind of emergency, and you repeat it. It is very important that you repeat it. Also, it is very important that all of your team members do or having the same knowledge and are capable of doing all of the steps. Why we are saying this? Because if you are having an emergency, and giving example, Dr. Adham is with me, and we are having our receptionist, and it's the role of the receptionist to call for the emergency. During emergency, uneventful events occur. Likely, the receptionist could faint. She could fall. So you should manage your patients and the receptionist. So your assistant should know how to call for help, how to bring, all of us should know how to call for help, how to bring the emergency kit, what to do. So we need to cover everyone.
Thank you, Dr. Muhammad. Another question is, once an emergency like syncope or hypoglycemia is stabilized in the chair, what are your criteria for deciding between discharging the patient to a family member versus activating EMS for hospital transport, especially if their vitals have returned to baseline?
When you are having any emergency, and the emergency, you manage it correctly, please do not operate, do not continue your dental procedure. Refer the patient to the emergency department to make sure that everything is stable. During our dental office, we are not equipped enough with the most common, most important equipments for assessing patients' vital signs. So if you're having emergency, your role as a dentist is to manage the emergency in your office and to stabilize it till the first responders arrive and manage the patients and transport the patient to the emergency department. But once your emergency is controlled and patient is controlled, do not complete the procedure. Refer your patients or accompany your patient to the emergency department just to make sure everything is okay and everything is fine.
Thank you, Dr. Mohammed. And the final question is, could the doctor please share the presentation with us?
I am not familiar with the policy of IADS, but okay, no problem.
Okay, Doctor. Dear Dr. Mohamed Hamdy, on behalf of the IADS Score Webinars team, we would like to express our sincere gratitude for your insightful session today on the management of medical emergencies in the dental office. Your practical approach to such a critical topic provided our participants with the essential tools and confidence needed for clinical practice. We truly appreciate the time and expertise you shared with our global community. We look forward to the possibility of collaborating with you again in the future. With best regards, IADS Score Webinars team. Thanks a lot.
Thank you, Dr. Adam. I would like to thank IADS for this kind invitation. I hope my lecture was fruitful and improved the knowledge for all of us. Thank you, Dr. Adam. Thank you, IADS, for this invitation.
Thanks a lot, Dr. Mohammed. Our dear participants, this is a quick reminder. Please complete the attendance and feedback form using your registered email and WhatsApp number to secure your certificate.